When we talk about the vision loss, and while we're just discussing the acute causes of the vision loss, one should know what is the particular kind of the history questions that we're going to talk or we're going to put forward to the patient just to get a better or just to get a minimized kind of a differential diagnosis in that particular patient. So as we've already gone through the unilateral and then we have the bilateral causes of the vision loss. So it's again very important what kind of a patient you have at your hand. If it is a patient of a unilateral kind of a vision loss, what can be the causative factors in that patient? One of the major factors that can contribute towards the acute kind of a vision loss are the optic neuritis. We have the macular degeneration in that person. That is again going to be an acute kind of a macular degeneration. Then we have the uveitis in that patient, which can be again the angle closure glaucoma. That can again contribute towards one of the causative factors of the acute kind of a vision loss, which is again of the unilateral kind. And then we have the corneal trauma or the keratitis, again unilaterally, depending upon just the eye that we're focusing on or the eye that the patient is talking about. So having known the unilateral causes of the vision loss in a patient, which is again of the acute kind, one should know that the optic neuritis, acute macular degeneration, retinal detachment is again very important. History is the main focus over here. You have that patient at your hand, and you're just elaborating the history just by getting to know the patient more over there. And then the bilateral causes of the acute vision loss, they have their own causative factors. Mostly when we talk about a bilateral condition of the vision loss, the causative factor, the cause lies in the central nervous system. Usually it's the lobe that is not, or the occipital lobe is not functioning properly, or it is it's under the effects of some toxicity. So running the blood tests on such a patient would clarify the condition more and would make the diagnosis more clearer in that patient whom we are talking about. So over here in the history taking, the objectives of the history taking is to get a reviewed differential diagnosis in that particular patient whom we're talking about. And then the relevance of this getting the history in a proper way from a patient of the acute vision loss. Why is it so important to relate to such a condition? Is it a very prevalent condition? So the answer to this is basically yes. It's again a very prevalent condition, and usually you get these patients in the emergency departments or in the outpatient departments, and one should know how to get about and how to manage these patients. Obviously, when we talk about the management right away starts from the history taking in these patients. So the basic information, what is the basic information that has to be collected from this patient? Basically, you have to get the complete history of the patient at that particular point. The history should include the systemic history, the ophthalmic history of the patient, the family history, the drug history. All of these components of the history has to be completed in that particular patient whom we are talking about. So moving on to the objectives. So why is it important to know how to deal with these patients? Because these patients usually present to you in the emergency departments as well as in the outpatient departments when you're working as a general physicians as well. So one should know how to refer these patients and when to refer these patients to the ophthalmologist or towards the experts. Which questions to be asked? Which examination techniques are important? So knowing these aspects of the management is again very important. It should not be the irrelevant questions that has to be put forward to the patient. Rather than more of the relevant kinds of the questions has to be put forward towards the patient. Pupillary responses is one of the examination techniques that has to be carried out in that particular patient. Visual field testing, red reflex ophthalmoscopy. Then which conditions are most likely to cause such a condition? I've already elaborated this. You can basically relate to the patient, knowing that whether he's suffering from the unilateral or the bilateral kind of vision loss, you can just exclude some of the causes. If it is a bilateral kind of vision loss, all of the causative factors which we already included in the unilateral causative factors, ranging from the acute macular degeneration, the retinal detachment, the corneal atrophies, acute angle closure glaucomas, or the optic neuritis, all of these causes can be excluded in a patient of a bilateral acute vision loss. So this is how basically you make out a differential diagnosis when you're working practically on a patient. So the relevance over here that has to be discussed, whether it is an emergent condition, whether it is an emergency, the provider and the ophthalmologist have to work together towards the betterment of the patient. First of all, running the immediate interventions, running the immediate tests on the person, just to get a definitive diagnosis in that patient and just to start off with the treatment modalities that are available for that particular condition. Then the urgent conditions. Immediate consultation is needed for the urgent consultations, and obviously the ophthalmologist is regarded to be final resort over here. And then in the non-urgent conditions, the appointment with the ophthalmologist is made within 2 weeks time interval, and because we find it to be a non-urgent condition and it can be treated, so we can wait just to about 2 weeks, not more than that, of course. So the basic information that has to be collected from the patient: is there any pain associated with the vision loss, or is the vision loss transient, persistent, or progressive in that particular patient? That is the main highlight over here when we talk about this acute kind of vision loss. And is the vision loss binocular or monocular? Again, the differentials is going to be found on this fact, whether it is the monocular or the binocular acute kind of a vision loss in that patient. How severe is the loss of vision is again very important and has to be asked from the patient. What was the tempo? Whether it was an abrupt or did it develop over hours, days, or weeks? This is when we ask about the tempo from the patient. This is the different terminologies that can be conducted. When was the normal vision last noted? And what is the patient's age? The age, the gender, the family history, drug history, systemic and ophthalmic history, they are going to be taken in detail in that particular patient. And if he or she is suffering from any kind of a medical condition, for example, diabetes mellitus, hypercholesterolemias, or hypertension, they have to be highlighted over here. Is there a history of previous ocular disease or surgery, or what was last normal vision noted? What is the medical condition of the body? Is there a history of any trauma or contact lens wear in the patient? The acute unilateral vision loss, the causative factors can basically include or range from the central retinal artery occlusion. Then we have the abrupt onset of the unilateral vision loss, usually profound vision loss if the branch field defects are noted. What are the visual fields that are affected in that patient? The retinal pallor is noted on the fundoscopy. Cherry red spots, if they are found, they are indicative of diabetes mellitus or diabetic proliferative disease. In that patient, visible ambuli, they are noted down, usually embolic, carotid, and young patients, they should consider the valves as well. And the older patients, we should consider the giant cell arteritis, that is also abbreviated as GC over here, and so one of the causative factors of the painless kind of the acute vision loss in the patient. So over here in this section, we just elaborated the history questions that has to be taken from the patient of the acute vision loss. So that is the end of this section. Thank you for watching sqadia.com.